Pancreatic Enzyme Replacement Therapy, or PERT, is medicine that helps your body break down food. In the UK, the most common types are called Creon and Nutrizim. When your body struggles to break down food properly, it can lead to symptoms such as weight loss, tiredness, abdominal discomfort, nausea, vomiting, altered bowel habits including urgency to go, pale or smelly stools, and stools that are difficult to flush. PERT helps manage these symptoms by improving your digestion. The usual starting dose is 75,000 units per meal or 50,000 units with a snack. It's important to spread the dose across the meal. Take one capsule at the start, one in the middle, and one towards the end of your meal for full benefit. For detailed guidance, refer to resources like those from Pancreatic Cancer UK or the Viatrix booklet on Creon. If symptoms persist or you continue to lose weight despite eating well, you may need to increase the number of capsules per meal, snack and nourishing drink, and consider adding a proton pump inhibitor, PPI, like lansoprazole or omeprazole to help the enzymes work better. You can safely increase your enzyme dose without consulting your medical team, as overdosing on PERT isn't possible. However, you'll need to discuss the adjustment with your medical team to ensure your prescription covers your needs. If swallowing capsules is a challenge, gently twist the capsule open, mix the granules with a teaspoon of an acidic puree such as fruit yogurt or apple puree, but it's important to remember to rinse your mouth thoroughly with water afterwards to ensure no granules remain under your tongue or in your teeth, as these can cause mouth sores. As your appetite and intake improve, you may need to increase your dose of enzymes to digest the additional nutrition. If you have diabetes, speak with your healthcare team, as your medication may need adjustment to better manage blood glucose levels. If you're struggling with eating or managing PERT, don't suffer alone. Speak with your doctor, your GP, your specialist nurse or dietitian. Joining a support group can also provide valuable tips and support from others who understand what you're going through.